I mean, I was an emotional wreck when I found out, especially going through it in like live and sharing it with the world. And I kind of felt like things didn't get told properly. My story didn't get told properly. And I was really upset about it. And I think that I really went through a lot emotionally because I just felt like, oh my gosh, like it really sucked because it's just like me leaning on certain people within my group. And I just feel like they had my back to really help educate the public, or, you know, I don't know. That's just...
I saw some of the comments also.
Hey guys, welcome back to my YouTube channel, and we are here with Dr. Taylor and Dr. Davis. We are at the Pelvic Rehabilitation Medicine Center. Today we're going to be talking a little bit about my endometriosis story, because as you guys know, it's Endometriosis Awareness Month and it's Women's Health Month, and I want to talk a lot more about that. I want to talk about my journey and how these two wonderful ladies and doctors have helped me through my journey. And, you know, you did my surgery and you've helped me through my pain, literally. Both of you guys. And so I want to talk about my experience. And, you know, as you guys saw on the show, I had endometriosis. I was diagnosed on the show by Dr. Davis. And so, unfortunately, you guys don't always get the gist of everything. You kind of get the edited versions, and I have to apologize. Unfortunately, you guys don't always get the full story. You know, you just get bits and pieces because these are edited, and so unfortunately, I feel like the producers are not educated enough to really educate the audience, and I feel like you guys miss out. And so that's why I want to have this sit down so we can talk about it. When I was diagnosed with endometriosis, actually it was prior. It was prior before I started. Well, no, it was right during while I was filming. And I had no idea. I had like an incident that happened in February. I went to the hospital and I had 2 cysts. And that's when Dr. Simone referred me to Dr. Davis. And Dr. Davis, you know, she explained to me about endometriosis, and I had no idea. And I'm sitting there looking crazy across from her, like, you know, I didn't know really how to react and how to respond, because it was when I was still in the cameras. I just wasn't used to being in front of a bunch of people and you were disclosing this information, so I didn't know what you were going to say.
No, I was really proud of you, of how you handled it, because that was a lot of information. Yeah. And I could tell you didn't have any idea what was going on.
No, I did not know. I was just like, oh, okay, you know. And I think that at first when you told me, I was just kind of smiling in a way, because I'm like, okay. And it was kind of like a nervous smile. Yeah. And I remember producers told me to okay, you just heard some news. I need you to react again.
But honestly, that's most people's reaction. They don't know how to feel or what to say, because they're like, what? Like, you're telling me that I have this condition I've had my whole life and no one said anything. Like, why am I just not finding out about this?
Yeah, because I actually have been having period pain since I was like 10 years old. And I remember like it was like the exorcism. Like, I remember I had got my cycle the first time and it felt okay, like, but it wasn't until like when I got home, I remember like the pain kicked in, and I was like, what is this? I was like crying to my mom, like, what is going on with me? I hate this. Like, I remember just like her giving me ibuprofen, and she gave me like 2, and I just remember I was rolling on the couch like, oh my God. And so I've always had these issues.
That's definitely not normal.
Yeah, and so I was told most of the time my mom would take me to the doctor. The doctors would just tell me, hey, you know, it pretty much is normal. Make sure you drink Gatorade and take medicine a couple of days prior. And so I did that, but I would still have issues. And so I was, you know, at times that my mom would have to take me out of school. Mm-hmm. A lot of the times, I mean, I was throwing up on my cycle, and I was like, what? I mean, and so my mom would always tell me about this. She would always tell me, she would tell me about the story of Adam and Eve and how Eve ate the apple. And she's like, well, you know, it's because Eve ate the apple. You know, that was the way to put it. Oh, goodness. Yeah. So I was very like distraught, and that I was still going through these issues as I got older. Mm-hmm. And I heard that sometimes it gets a little better as you get older from some people.
It can depending, but most of the time it progresses.
Oh, because it progresses.
And sometimes we see patients, their pain on their periods becomes an everyday pain. So it's common for them to come in and actually feel worse than they were as a kid too.
Wow. Yeah, my mom, my mom always had bad period pain, and then she said after she had kids, it got better. And so I don't know if it's because the pain, like after you having kids? Like, I know it's very painful.
Well, no, there's some hormonal changes that happen during pregnancy that sometimes can quiet the down endometriosis. It doesn't make it go away, but in some people it makes it better, at least for a little while. But also your mom just may not complain.
I don't know how she did it because she lived in the country and she could have access to certain things. And I was like, oh, hell yeah. And my sister also had the same issues, but she wasn't diagnosed with endometriosis, not as yet. I don't know if she has it or not. I told her she should probably kind of look into it because you never know. And as I got older, and I went to several doctors and stuff like that, I had fibroids. I knew that for a fact. And even in the military, I would go and I was going to the sick call when I was sick and I was throwing up. And I'm like, I cannot get over this. I don't know what this is. It can't just be period pain. It just,
no, there's no such thing. It's just a bad period. Your period is not supposed to be debilitating. You're supposed to be able to go to work, go to school, do whatever it is you need to do. And just to back up, I want to explain to the audience exactly what is endometriosis. So endometriosis is a disorder where tissue that's similar to the lining of the uterus is found outside the uterus. And that tissue, every time you have your period, becomes inflamed, and that inflammation can lead to pain and scar tissue. So endometriosis is very common. It affects 10% of women. It can run in families. So if your mom or your sister or your aunt have endometriosis, you're more likely to have it. And it takes about an average of 10 years to get diagnosed here in the U.S.
wow, that's a long time.
And one of the reasons it takes a long time to get diagnosed is because we often can't see it on imaging.
Okay.
You only see it at the time of surgery. That's not a good enough excuse. We should still be able to diagnose it based on your symptoms, right? Because it's not normal to not be able to get out of bed.
Right.
It's not normal to be throwing up and passing out as some of the things that women experience. Black women, it takes about an average of 15 years to get diagnosed.
Wow.
And that's for several reasons. You know, sometimes they're not listened to as much when Black women were prone to have fibroids. And so fibroids we can see on imaging, and the fibroids tend to get blamed for all the pain.
Okay.
And they're like, well, this is the fibroid issue. You need every uterus removed, which is not the answer.
Yeah, I think whenever I did go to the doctor, they saw that I had the fibroids. They said that it shouldn't cause pain because I had pain back then a couple of years ago prior to the cyst getting bigger. And so they were like, we'll just monitor it. And I would feel something, but I didn't know what it was. It kind of felt like it was like a strong cramp, and they kind of had to use the restroom in a way. And I was like, I don't know what this is. It's the weirdest thing. And so it's just crazy. Many times I went to the doctor, and the many times they were like, oh, just get on birth control. And so I didn't feel comfortable getting on birth control. And so also didn't want any complications in case I wanted to have children later. I just wanted to be, have a clean slate.
Yes.
Started out. I'm not saying that birth control was bad, but I just didn't want any side effects. And because having kids is really important to me. Finally, whenever I came to your office, it was just like, oh, finally. And honestly, if you look back at it, it took me like at least 20 years to get diagnosed. Yeah. Over 20 years to get diagnosed.
Yeah, because you started caregiving.
Yeah, and so, it was kind of devastating, like doing the show at first and how they portrayed it, because they made it seem that I lied to my husband about it, when that was honestly the first thing that we filmed. And, and also my husband's a psychiatrist, and he also went to school for internal medicine, so he knows a little bit, I'm like, and it was very embarrassing when we first started dating, because I was like, having to tell him like, oh, I got this thing. And I remember like constantly going to the bathroom. He's like, what's wrong with you? I'm like, having to explain this to him. And he was like, I never met a woman that had to sleep with heat tattles. Right?
Yeah. I wanted to ask you, like, when you've been in pain for so long and been suffering, you don't know what it is. How does it feel? Because obviously there was a period of time before we had surgery, before you had to take a relief of pain. Like, how did you feel between being diagnosed, like knowing what was wrong?
I was very curious, and I was getting on Google a lot.
Yeah. Do you think you self-diagnosed yourself with endometriosis?
Yes. After a while, I was like, I should have known. But
no, it's not true.
I was like, I should have known maybe, but you really don't know, because you said the only way to diagnose endometriosis through laparoscopic surgery. And so I was doing a lot of research, but not only that, like my symptoms, I was really tired. For some reason, I was out of breath and tired. And so I was like, what the heck? Like, this is the weirdest thing. And so when I was filming, I was just really just exhausted all the time. And like, what's wrong with you? You're young. And I'm like, I'm going through some things. My body is going through some things. But I didn't realize that I would be so tired, because I just noticed I was like, when I was walking, I was out of breath and I was sweating, like that is not me.
And everyone thinks, endometriosis is like that gynecological condition. My gynecologist needs to take care of this. They should know. But it's technically like a whole body disease. Again, like Dr. Davis said, the lesions are outside of the uterus, and technically, usually they're in the pelvic area, but they could be anywhere. Plus all that inflammation, it just, affects the whole body. Your body's kind of in this fight or flight mode. And when you're in pain, the nerves, the muscles that we treat get involved. But then, there's a lot of overactivity going on, making you feel exhausted and just kind of wiped. It can affect your sleep. And, a lot of patients coming in, they're like, I can't sleep because I'm going to the bathroom all the time, or I just don't feel well. So there's just so many components to endometriosis, and I think we still have a lot to learn even to this day.
So one of the main symptoms is pain. So pain with your period. During your cycle, you should be able to get out of bed. You should be able to go to school, go to work, do everything you need to do. So if your pain is so severe that you're not able to get out of bed, not able to go to work, that is a sign that's abnormal. If your periods are heavier, where you're having to change a pad more often than 2 to 3 hours, or if they last longer than 7 days. Some other symptoms that people may not think of are pain with sex. Like sex should never be painful. And so sometimes that is the case for a woman with endometriosis because of the inflammation. Having to pee all the time.
I had that.
And there's also some non-specific symptoms, like Dr. Taylor said, it's a whole body disease. It causes inflammation. So you can just feel fatigue or more prone to suffer with anxiety and depression because they're in chronic pain right now.
Yes, I went through the depression. That's what I was going to talk about, affecting my mental health, because I was really sad. I'm like, what is going on with my body?
And I remember you telling me how you had to, change your schedule based on your period. There were certain days where you were like, I can't go out, I can't spend time with my friends, and now that's
it's been a lot better. I'm a lot better now. It's really amazing because I feel like I'm free. I feel like I'm finally free. I still get cramps, but with ibuprofen and some of the medications, it definitely helps. I was having a lot of back pain whenever I had endometriosis, because I remember right before I went to the hospital, it was demon time in the bedroom, the little teapot. And my back was hurting really bad. I thought something was going on with me. And I'm like, what is going on? My back is in so much pain. Mm-hmm. And then the next day, that's when I went to the hospital. Yeah. It really makes you not in the mood. And, that's when it starts to really affect your mental health, because you want to, be pleasing to your partner at the same time, but you're in pain. So you can't do that, and I'm full disclaimer. We talk about everything. We're talking about everything.
Do you want to talk about the details of your case and what we saw on imaging?
Yes, I do.
So endometriosis, again, most of the time we cannot see on imaging. You have to see it at the time of surgery. Laparoscopies, where we make an incision in the belly button and go in with the camera and look, and we're able to see those endometriotic lesions. But there are cases where the endometriosis is so severe that it's a thickened area large enough to see on an MRI. Mm-hmm. And in your case, the endometriosis had caused 2 large cysts to form. They were about this big, the size of grape cheese, in addition to having a grapefruit-sized fibroid.
Yes, I just remember when I came in for the surgery, I was super nervous, but I was like, finally, we can get this done, because I really wanted to wait till after the season. And when we finally were able to do it, I was just like, thank God. And I actually came in with this shirt, blaming on the endo, because people get endo belly. People get endo belly, and and I feel like I get that sometimes, and my stomach swells up, and everybody's like, what's going on with your stomach? Because it was getting swollen, and so I'm like, I don't know. And I've seen cases I really got into TikTok because I started looking at other ladies that had endometriosis, and some people, they get so big to the point they look pregnant. I'm a little self-conscious about my area, because sometimes I feel like I might be a little inflamed. And so sometimes I'm like, I know like eating has a lot to do with it too. Certain things get triggered endometriosis.
Exactly.
So I'm trying to change up some of my diets, kind of eliminate some of the sugars and stuff like that.
Anything that you eat that decreases inflammation, so fruits and vegetables, some supplements like turmeric, green tea, extract, things like that can help decrease inflammation and sometimes help your symptoms. It can't cure it necessarily, right? Like, so it's not, you don't have endometriosis because of what you eat, but your diet can play a role in helping your symptoms.
Do people feel that PCOS do they think that the symptoms, is it similar?
Sometimes they can overlap because, again, sometimes with PCOS you'll get these cysts, and with endometriosis you can get these cysts. And so obviously on imaging you can see those cysts. So when people have those cysts, they get diagnosed with PCOS, but it might be endometriosis, or you could have both at the same time. The symptoms, again, sometimes both are very inflammatory, so there could be discomfort in that pelvic area, but sometimes they present very differently, where with PCOS commonly you're going to have like very irregular periods, not necessarily with endometriosis, the pain, and then with PCOS there could be more hair growth, sometimes changes in labs like insulin resistance. So sometimes they're very related. Sometimes they come separately, sometimes they come together. And so having your doctor kind of, first of all, get a good history, right? Mm-hmm. Go to good exam and do a full proper evaluation and have them be open-minded and looking at both things.
I think that whenever I went to the primary care provider, I think I probably should have like really pushed to go to like a gynecologist and like someone with specialty, because I remember going to a lady and she's like, that's it. I mean, we tried birth control. I mean, that's it. And I'm like, there's no other way other than birth control and taking, ibuprofen or Tylenol. And so I wish that I could have pushed myself more to go.
Well, you did the best you could with what the knowledge you had.
Yeah.
And I really commend you, and I think you're very brave for telling your story so publicly, because this is going to help a lot of women that, haven't gotten diagnosed yet. They just know they have these symptoms, and now they're going to know, what to ask their doctor.
Mm-hmm. I mean, I was an emotional wreck when I found out, especially going through it in like live and sharing it with the world. And I kind of felt like things didn't get told properly. My story didn't get told properly. And I was really upset about it. And I think that I really went through a lot emotionally, because I just felt like, oh my gosh, like it really sucked, because it's just like me leaning on certain people within my group, and I did feel like they had my back to really help educate the public, or, I don't know, that's just.
I saw some of the comments on social media. It was hard for me not to jump in there.
So in Letitia's situation, I met her many months after surgery. Dr. Davis did a fabulous job. But like we said, she's been hurting for 20 years, right? That's more than half her life. And when I met her, she was feeling better, but she was still hurting. She was still having abdominal pain. All those urinary symptoms were still there. Intercourse was painful. Yes. And again, her body has been used to being in this super inflammatory state. And then, so my role, I'm a physical medicine rehab doctor focused on pelvic pain. And my role is to address the pelvic floor, those muscles that are holding everything. And those muscles get inflamed and they start guarding. And then those nerves, they start to overfire. So when I first examined you, everything hurt. Everything was hurting. Belly was hurting, pelvic exam was painful. Even though the endometriosis was out, those heavy fibroids, those cysts were out, her pelvic floor was just used to feeling that. So our treatment is more so to help kind of take those pelvic floor muscles, teach them how to calm down, and get those nerves to stop being overfiring. So part of the treatment was our injection series targeted towards those very specific nerves and muscles. We also added on some medication, but medication used so that we're retraining, not so that you are dependent on those medicines, but to help calm down those nerves and muscles.
Yeah, so I loved it because she gave me some CBD capsules.
Yes.
Those were amazing.
Yeah.
the thing is, I had never heard about that. I was like, there is a God.
And they're nerve and muscle medicines, and instead of taking it by mouth, we're taking it
Yes.
correctly.
I thought that was the coolest thing. Like, I was telling everybody about it. Like, oh my God, I don't have to just take ibuprofen. Like, it worked wonderfully. And, I'm not dependent on it. I still have a refrigerator. But like in the beginning when we were doing with the injections and stuff like that, when I was using it, they really did help. And I was like, what? I couldn't believe that they had that. And I wish that someone would have educated me a long time ago about this. And so I don't know if there's enough research done on endometriosis. And, I think they're still doing a lot more research now.
There's a lot of research that needs to be done because we don't know exactly what causes it. Don't know what genes are involved. That we know it runs in families. And it's probably multifactorial, right? It screens that there's many causes. And you don't do enough research in women's health conditions in general. But endometriosis is one that it affects so many, 10% of population of women is huge, not able to play sports, they're not able to go to school, they're not able to go for promotions at work, or they're missing work. And it can affect every aspect of their lives. So it's a huge problem. So it is a chronic disease. So whether or not, how many surgeries you have to have or whether it comes back after surgery depends on how your surgery is done. The standard of care here at PRM is we excise or cut out all of the endometriosis. All of visible endometriosis, you have to do a very thorough surgery. And there's a recent study that came out that showed that only about 10% of people who had a thorough excision surgery were cut out the endometriosis had to have another surgery in their lifetime. The really important thing about endometriosis care is it's not just surgery, it's not just medication, it's not just birth control. We really have to work together, and you need a multidisciplinary team. That's why it's so cool to be in the same practice with Dr. Tailor, to just work together.
Yes. I'm so excited about this. Both the days.
I think we were talking earlier about like the nutritional components. Like, again, we want you to be active, like the therapy, like there's certain things we can control, certain things we can't. So again, maximizing the things that we can control, right? Like we can't be 100% perfect either. And so again, just in general, minimizing the inflammation that we're surrounded by, whether it's stress or nutrition or movement, all of that puts into play as well.
Well, I was a stage 4 in endometriosis, and I want you to explain some of the stages, because when you said that, it was like dang, like cancer or something. I was like, dang, I can't believe I'm stage 4. I was like, what does that mean?
So the staging of the disease has to do with the surgery, right? Just has to do with how much endometriosis is everywhere. And so stage 4 disease is when you have endometriosis that affects both ovaries, and that causes ovarian cysts, and you have adhesions of basically the uterus to the bowel. The thing that's interesting about endo is that the stage does not necessarily correlate with the pain, right? So stage 1 is someone that may just have a couple of spots that we see during surgery, and it's a simpler surgery, but that doesn't mean that the patient can still have just as much pain. And there's patients with stage 4 endometriosis that don't have pain. So correct, there's a lot you need to study.
Yes, it is.
And for those patients that don't have pain, sometimes it gets picked up when they're trying to get pregnant. And endometriosis can affect fertility depending on, the inflammatory aspect, where the lesions are. And so sometimes we have patients coming in saying, I never really had symptoms. However, I had a hard time getting pregnant, and then surgery was, their workup was done. Ultimately, they had surgery, and they were found to have endometriosis. So again, that quality of life and that fertility aspect, endometriosis can be a top diagnosis.
I think a lot of people, is a misconception, because a lot of people think that having endometriosis, you're not able to have children. And that was not the case. That's not what you said. That's what I clarify. Because a lot of people are going around here, and ladies, I want to educate all the ladies out there, you can still have kids with endometriosis. It's not the end of the world. And so I wanted you to explain a little bit more about what will deem you as infertile, what is considered infertile, and that, if you're infertile. Or my experience whenever I was on the show, it's just like, okay, you couldn't have kids. I'm like, that's not what she said.
Women with endometriosis, about 50% of them will have some struggles getting pregnant. All right, and the definition of infertility is when you are having unprotected sex for a year and there's no pregnancy, right? So even if y'all are being careful, doing other things, right? But there may be something there, right? That 50% that do have infertility with endometriosis, for some reason, we don't know the exact reason. Sometimes it's structural, sometimes the scar tissue blocks the tubes or blocks the uterus, and that's the reason. But it's most likely due to the inflammation, right? The important thing to remember is that there's treatment for infertility. There's an entire subspecialty of gynecology dedicated to helping women get pregnant through various medications and procedures, and IVF, and then sometimes excision surgery can help people conceive naturally as well.
I currently am going to Emory's to the Reproductive Health Center, and seeing Dr. Pcos. And before we did the IUI, I had to get a polyp removed, and so I didn't know what it was. I was like, okay, I had a little polyp, and so when I got it removed, and I remember when you get my surgery, both my tubes were clear, and so far they're still clear. I just wanted people to understand, like, okay, this is what you deal with endometriosis when it comes to trying to have a baby, and so like I've had a lot of ups and downs, just going through the IUI. I've done it twice. I had 2 failed IUIs, and right now we are looking into the IVF now, and so. I just want to make sure that I'm not jumping the gun, and I am trying naturally, but also, with the IUI, I just felt like, I made it go for the IVF, and it's more effective.
I think, that whole concept, and I know that I consider early conceiving naturally, like it's a miracle. Your heart's desire is to have a baby. You use whatever's at your disposal. There's nothing that makes you less than. Your worth is not determined by your ability to get pregnant. No woman's worth is determined by their ability to get pregnant.
Well, I try to be optimistic, and so a lot of times when people are saying infertile, if I was ever being infertile, I just said that I was going to be in control of my fertility. Like,
it's not a medical term that you're infertile. You may struggle with infertility. It's a disease, just like endometriosis, just like diabetes, but you're barren and fertile isn't a word for you.
Okay.
Yes. Right.
We're just still on your journey.
I am on my journey.
Actually, not that long ago, that endometriosis was just a disease of white women, and Black women didn't really suffer from it. So that's some of that stigma is still there. Even I was taught that in medical school, and so that's part of the reason there's more of a delay in Black women getting diagnosed with endometriosis than white women. But it can affect everyone equally.
Yes.
And even with fibroids, so 80% of Black women will be diagnosed with fibroids before the age of 50, but the 70% of white women, right? So this is extremely prevalent. It affects everyone.
We were kind of talking about this earlier this week, kind of that delay in care, being heard. It takes, the statistics are, it takes about 7 to 10 years for someone to get diagnosed with endometriosis. It takes longer for a Black woman to get diagnosed with endometriosis. Again, coming from an Indian heritage, there's endometriosis out there, but I feel like culturally sometimes Indian, South Asian women aren't very vocal, so there may be a higher percent that we're missing. And that 1 in 10 women in general having endometriosis, that may also be underestimated, where women are not getting diagnosed, women are not speaking up, or women are not getting heard. So it may be more common than 1 in 10.
I wish that a lot more of us can advocate to get out there and bring this more to the forefront and bring awareness to, and so we can address some of these issues and help others, because I wish that I had someone to tell me, hey, maybe you need to go to a specialist. Maybe you need to do this. My sister, she had her issues with period pain, and I'm like, I wish I could have dig more.
Well, I do want to talk to your audience about ways they can advocate for themselves.
Yes.
Right. So say you are having some of the symptoms we talked about, and you're worried that you have endometriosis and or fibroids, and your doctor's telling you everything's fine, right? One, in a perfect world, just get a second opinion. Go to a different doctor. I know everyone may live in a place where they don't have access to just go to another doctor. If you have a good relationship, even if it's your primary care doctor, you ask them for a pelvic ultrasound. So we can't see endometriosis on a pelvic ultrasound, but we can diagnose fibroids. And that's kind of the first step to seeing what's wrong.
Okay.
And you need to make sure that you feel heard and that you feel believed. A great thing to do is also to start documenting your symptoms. Write down how you feel every day, your pain scale on a scale of 1 to 10, how your bleeding is, and this is just throughout the month. And so sometimes we go to ask you questions, we're like, well, do you have pain with this? And you're like, yeah, I didn't put that together. You could put that together yourself and present it to a doctor. It's written down. That takes a lot out of the visit, where you're saying, "Hey, I've written down exactly what's wrong with me." And for people who don't have access in their cities, there's online second opinion services, right? So you can see a specialty gynecologist online. Here we do virtual consultations here as well.
So, like I said, I'm physical medicine and rehabilitation. I've always had a love for women's health, but I never felt OBGYN was the right specialty for me. But I love treating people for getting them functionally better. You know, patients will come to me and say, I have a hard time with this, this, and this. And here it's often pelvic pain, sometimes pain with intercourse, pain with movement. And I love to be able to reach the goals that the patient has, right? We're not following numbers. We're not kind of just following blood work. It's what the patient's goals are. And again, really bringing it together, majority of my patients are women, not 100% because I see men with pelvic pain too. But it's really wonderful to work one-on-one with a woman and be able to say, hey, like, these are our goals. Make sure she feels heard and understood, and kind of look at the whole picture, right? Because sometimes fertility is part of the plan. Sometimes it's a work thing, or sometimes it's, family obligations and things of that nature. And I just really love kind of putting that all together, and, following you and our patients through their journey. And It's so rewarding.
And it's so rewarding to see every time I come in. You're just so warm and and like you're always like, she's always so happy, and I'm like, okay, let's do this. Like, especially when you have she's doing the injections, and so she can make me feel comfortable and warm and sweet. Yeah. I'm like, oh yay.
Yeah, when we do our injections, it's kind of like a weekly visit for several weeks. Again, we're targeting different nerves and muscles, and each time, I don't want to focus just on the needle, so we'll always talk about something else.
Yes, and by the end, we had, how many shots did we do? Was it 6? 7.
Yes.
And by the end, I remember, laid back in the chair, yeah. I even try to, I don't look, because I think they usually kind of have, a little sheet.
There's a little sheet. Yes.
So I don't see the needle, because I don't like needles, but let me tell you, afterwards, I'm feeling really good. I'm feeling really good. My muscles are a lot more relaxed. I'm comfortable, and usually, most time I'll go home and take a nap. Yeah. I love the experience. So
I always knew I wanted to be a doctor, ever since I was 8 years old. And one thing that really pushed me into women's health is my grandmother actually died of cervix cancer, which is also something that's completely preventable with past years, right? Just because she wasn't educated on what she needed to do. So in medical school, in residency, I love surgery. Right? I love minimally invasive surgery. I love the ability to fix these huge problems through small incisions, so patients can get back to their lives faster with less pain. And one of my favorite parts of my job is really empowering women to make their own decisions about surgery, because often, I think Black women of color, you push down our symptoms, right, and we're scared of surgery, and viewers, don't necessarily trust doctors, which for a good reason. And so I really enjoy explaining all the different surgical techniques and letting them, making them feel comfortable with making that decision instead of delaying treatment.
And so, those that are watching, please go to the doctor. You never know what you have. You don't want to get to a point when you get there and then a week later you're gone. It's just, you have a lot of family that depends on you. And so I'm glad that I found out when I did. It did take me 20 some years to find out, but I was being proactive with my health. I did go to the doctor. I did all the right things. And so, I hope you guys have to get some key takeaways from Dr. Davis and Dr. Tailor. They're here to educate us and, and advocate for us, and, and teach us how to advocate for ourselves.
So again, a big takeaway, kind of like I was saying, kind of just focus on the whole body, right? And that can include, like I said, what we eat, what we do, getting enough sleep. Sleep is a big thing where our body is restoring and it's healing. Sleep is healing. Mm-hmm. And so getting enough sleep, culturally we, a little wine and alcohol is fun, but sometimes it can add a little bit of more inflammation and irritation. So it's not to say don't drink or anything like that, but minimize alcohol use, obviously not smoke, but being active.
Right.
You know, when we're active, whether it's a walk, a simple walk, getting that blood flow through our body. And then there's a lot of research now to show that spending time with loved ones is like so therapeutic. So obviously doing all the medical things that we do is very important, but some of the basic things like eating well, spending time with our loved ones, and, you know, getting good sleep can be so important.
I love that because especially my sister, she has a 6-month-old, and so I just feel like every time I see them and my nephew, it's like my energy is being stored. Look at this, I love that.
Being auntie is best.
It's the best. I really appreciate you ladies for, you know, just talking with me and supporting me and bringing me back to health. Because look at me, I'm smiling. You know? I think the last time we talked, like I was crying. Actually, I was really upset. I was very upset, and I've done a 360, and I have to say that I'm proud of myself, obviously, for sharing the journey, because it was not easy. It was tough. I felt like it was a battle, you know, and it was great to have, you know, it's great to have my family and my friends that support me, and then, you know, and for you guys to clear the air and educate the people, because a lot of people, they just don't know. They don't know really. Like I've literally went on to, I've seen all these bad comments, and so some of the things that I'm like, oh my God, let me educate you.
Well, you don't. You can just not. I can write you don't read the comments.
Oh, let me just educate you. You don't know. You don't know. You don't know my journey, and you don't know my story. And so, thank you, ladies, for allowing me in your office.
We're proud of you. For patients like you, like this is the reason we do what we do.
Yes. Please come out. Please come out and see them. They're great ladies. They're very educated. They know a lot in their field, and I think that you guys would love to come here. Like I have no regrets. I love coming here. I love Dr. Tailor and Dr. Davis. You guys are amazing. I appreciate it. And this is Endometriosis Awareness Month. It's Women's Health Month. And get out there and go and check on yourself, okay? Check yourself before you wreck yourself.